Now, first things first, got to say good morning to Dr. Nathan Chiboyo. Good morning.
Yes, good morning.
Thank you so much.
Good morning to all the listeners.
Lovely. Thank you so much for joining us this morning. Gotta say good morning to the ladies in studio as well, Evelyn as well as Haley. Thank you so much, ladies, for joining us. Good morning, ladies.
Good morning.
Is it a Monday morning for you guys? It's a Thursday. Lovely to have you in studio today. Now, we are discussing TB screening services at tertiary institutions. Now, first things first, I'll take this one up with our guest from the ministry, who is Dr. Nathan Chiboyo. Doctor, tell us, what is TB exactly, and what are the earliest symptoms of a TB?
All right, thank you very much. So TB is one of the diseases of public health concern. It affects a lot of people at population level, specifically those that living in overcrowded places and those that are living with HIV, amongst other risk groups that are also mentioned. So TB is a communicable disease, so it is spread from one person to another. And this is primarily through respiratory symptoms, respiratory system. That is, someone can spread through a cough, so that someone can, who is close by, can also get in contact with air droplets, or there's an airborne disease predominantly. So it affects around 10.6 million, that is using last year's statistics. 10.6 million fell ill with TB globally, and around 1.1 million succumbed to the disease. So you can appreciate that this is indeed a disease of public health concern. And Zimbabwe is among the top 30 countries with a high burden of TB, HIV, and also drug-resistant TB. And we are also being monitored in terms of our TB prevalence as a country. So indeed, TB is a disease of public health concern. So I think that's pretty much summarizes what TB is.
Thank you so much there, Doctor. Now, also, what are the causes of the disease?
All right. So in terms of the causes, TB is caused by a bacteria that is called Mycobacterium tuberculosis. Yes. Then in terms of the early symptoms that someone can tend to have, TB is mainly a chronic infection. It is slow growing. So it takes time for someone to then present with symptoms. But then when they do present with symptoms, it's mainly a cough. So among people living with HIV, this will be a cough of any duration. Then among other people who are not living with HIV, we just say a chronic cough, at least 2 weeks. And also someone can present with weight loss and night sweats, and also a fever. So these are the common symptoms that people with TB tend to present with.
Thank you so much, Doctor. It is Star FM if you're just joining us. So we are talking to Say What, and today we are talking about TB screening services at the tertiary institutions. And here I am talking to Dr. Nathan Chiboyo, as well as going to be speaking to Evelyn and Haley Peewee. Now, Doctor, who is vulnerable to TB?
All right, thank you very much. So in terms of vulnerability to TB, over the years, the highest risk factor that has been noted is usually people living with HIV. So these are at a significant risk of acquiring TB and also progressing to active TB disease. So people living with HIV, also in our context in Zimbabwe, that's the number one driver of TB. Although we are now realizing other risk factors in our setup. We talk of miners, especially those working in artisanal small-scale mining communities, as well as ex-miners and families of miners, because of the risk of household contact. So someone living with HIV, people working in mining communities, household contact of a patient with TB, as well as people working in hospitals that's at risk, especially in the laboratories, as well as people staying in congregate settings like prisons. And we also realize an increased risk of TB among extremes of age. So children that are less than the age of 15 years, mostly those below the age of 5, are at significant risk of TB, as well as the extremes of age in terms of the elderly. So those above the age of 65 years are also at an increased risk of TB disease. We have also realized an increased risk among patients with diabetes mellitus. So with increase in non-communicable diseases, we're also realizing that they're also at increased risk of TB. So predominantly patients with a form of immunocompromise. So it can be people living with HIV, it can be diabetes. Also those with cancers are at increased risk of TB. So to sum up, I would say patients that are living with HIV, household contacts of someone who has TB, extremes of age, those working in mining communities, as well as those staying in congregate settings.
Absolutely lovely and edifying there, Doctor. Now, also you did mention the relationship between TB and HIV, but one would then ask, does it mean the same person? Does it mean that if one tests positive for TB, the same person will test positive for HIV, or vice versa?
No. So, in terms of the relationship between TB and HIV, so TB is a standalone disease, and HIV is a standalone infection leading to a disease which is AIDS. So people living with HIV are at an increased risk of acquiring TB. So in terms of the statistics, we say that annually people living with HIV have a 10% risk of developing active TB if they are infected with TB, compared to a risk of 10% in a lifetime for people that do not have HIV. So what HIV does is an immunocompromising infection. So it then tends to put patients at risk of opportunistic infections, and TB happens to be one of the opportunistic infections. But in our context as Zimbabwe, in terms of the patients that we see with TB, around less than 50% are now co-infected with HIV. So if we see someone with TB, we also then rule out the other possible risk factors. So it's not that everyone with HIV develops TB or everyone with TB has HIV. However, TB is a high priority disease as it is an opportunistic infection among people living with HIV. And we prioritize TB screening for all patients that have HIV, and we also screen for HIV among clients that present with TB. So WHO, which is the World Health Organization, guides us as national TB control programs to ensure that we offer what we call TB HIV collaborative activities. So someone needs to be screened for TB if they are living with HIV, and someone who has TB also needs to then be screened for HIV. And the good thing is that with the adoption of new innovations, we now have medicines that can be used to prevent people living with HIV from developing TB. We call them the TB preventive therapy. So these are medicines that are available, and as a country, we've also adopted these medicines to make sure that we reduce this substantive risk of developing active TB disease among people living with HIV.
Thank you so much there, Doctor. Now, you mentioned that it is important for people to go for screening. Where do people go for screening services and also treatment in Zimbabwe?
All right, thank you very much. So as a country, we have decentralized TB screening and treatment services. So essentially at all health facilities, it is mandated that they do offer TB screening as well as TB treatment. Then we do have a special program that is running to cater for those that I mentioned that are in congregate settings, and also those that are living in marginalized communities very far from hospitals, as well as those that have a significant risk due to their economic activities, like I mentioned, the artisanal and small-scale miners. So we have a program of an outreach which is called Targeted Screening for Active TB. So we have a mobile track that is decentralized across all the provinces to target especially screening and diagnosis of those that we mentioned to be at a significant risk, that may be away from or that may be staying far from healthcare facilities. So essentially TB screening treatment is being offered across all the facilities in the country. And also special to mention is that TB treatment is currently for free. So someone needs to then present at the facilities, they have the symptoms, they are screened, and if they are diagnosed of TB, they do access TB treatment for free across all the facilities that we have. Primarily, TB screening and treatment is being offered in the public health sector. So someone in the private then needs to be linked to a public facility so that they can access TB treatment and care.
Thank you so much, Doctor. There, much edifying information and nuggets. I'm going to have to let you go for this one, Doctor. Thank you so much for joining us. I can imagine you've got different elements to tackle this morning, but thank you for joining us. I will be then talking to Evelyn and Haley, but thank you, Doctor.
All right. Thank you very much.
I was talking there online with Dr. Nathan Chiboyewa, and I still have Haley Piri and Evelyn Mungwar with me in studio to furthermore discuss TB screening services at tertiary institutions. If you're just joining us, good morning and thank you and welcome to Star FM. I am talking to Say What, and we are talking about TB screening services at tertiary institutions. Now I'm going to bring this one up with you, Evelyn. What challenges are you facing when you want to access TB services, both screening and treatment?
Good morning. So we at the tertiary institutions, when we want to access these services, there is lack of knowledge. Some of us, we don't even know that TB screen treatment is for free, and we are not aware of where the services are offered. But at University of Zimbabwe, they are offering TB screening, so we can go there and access them. So the other problem we are facing is stigmatization. There's a misconception that when we have TB, it's obvious that we have HIV, which is not it. So we students, we are not well informed about it, and this now leads to fear of discrimination due to information gap. So it becomes a challenge for us to access the screening service at tertiary institutions because of the discrimination and the stigmatization.
Thank you so much there, Evelyn. Now, one more. What kind of support do you need as young people to access TB services?
Okay, so I think prioritizing youth in National TB Response Program would be of great support. For example, some TB programs mainly focus on high-risk groups, like the elderly people and the pregnant, which is a very good thing. We also need to consider the minors, like we youth. So increasing meaningful youth engagement in the TB response will be of great support.
Thank you so much there. Haley, what are your experiences with TB patients, especially young people and students, and what are your recommendations as well?
Okay, thank you. One of our experiences as healthy personnel is we face ignorance from the young generation. This time you tell them on drug adherence, the next time they go out there they default, which leads to drug resistance TBs and further damage to the lungs. We also face they lack knowledge, these guys, on what causes TB, how can we prevent TB, what are the treatment measures that they take when one has been diagnosed of TB. So in order to counter that, we have been providing health education in different facilities. So we also face hygiene problems when it comes to patients that are struggling with we talk of cough etiquette. they don't practice that, some of them. So how can I help you when you are not helping me sometimes? So it's a two-way communication between me and the patient. These are some of the things that we have been struggling. But however, we have we have made good relations with our clients. They tell us what they are experiencing, and some of the things that we are learning from them. Some of them will explain how they got the bacteria, such as drug induced things. So in some of those things, they enlighten us on what these young generations are facing. So we have also experienced good prognosis when it comes to TB. TB can be treated, and as of now, there is a good prognosis when it comes to TB. These are some of the things that we have been experiencing.
Thank you so much there, Hayley. Thank you so much entirely for sharing with us and taking the time out to come and talk to us. I mean, as Say What, and also as standing as students, and also advocating to make sure that people go for TB screening entirely. Now, I was talking there to Say What, and also remember that Say What is celebrating 20 years of championing students and youth access to health services. Now, you can dial 577 at any time in order to get support, as well as for you to know that this program was brought to you by Say What with support from the Embassy of Sweden.